This video provides an overview of what school health services are available through Preschool for All in Multnomah County. This presentation allows you to pause, replay, or revisit any section as needed. You also have the option to adjust the playback speed to a slower setting. Preschool for All includes nursing services to support students with health needs across more than 700 sites in Multnomah County. This coming school year, 6 registered nurses will be assigned to serve these locations. Preschool sites will be notified of their assigned nurse in mid-July. Please make sure your email address on file with PFA is current, as this will be the primary way you are informed about your assigned nurse. We are excited to introduce our team, including Carrie Barnett, nurse supervisor, Megan Gard, nurse on the feeding team, Leslie Navarro, Hispanic KSA nurse, and Monique Norwood, Black African American KSA nurse. We are also expanding our team and look forward to sharing more updates soon. The PFA nurse reviews health questionnaires completed by families during enrollment. They also provide training and support to staff regarding students' health conditions. This creates an inclusive environment for all students, including those with medical conditions. Their role is to address health needs that impact attendance and connect families to resources. Examples of resources provided are those to food pantries and student health centers. Referrals for feeding, hearing, vision, and dental concerns may be completed. The nurse teaches health-related classes, such as hand washing or toothbrushing, as time allows. PFA nurses also collaborate with Multnomah Early Childhood Program, or MECP nursing services. If a PFA student has an Individual Family Service Plan, or IFSP, an MECP nurse may be assigned to that student. This is a sample of the Student Health Questionnaire. The form should be included in the child's enrollment packet and completed at enrollment. A new health questionnaire should also be completed when there is a change in the child's health status or when a medication is brought to school. Translations of this form are available in Spanish, Russian, Vietnamese, and Arabic. The Office Use section at the top allows site providers to note 3 things: the student's program year, if the form was uploaded to Google for the nurses to review, and the date it was uploaded. The nurse reviews the questionnaire for health information, identifying conditions such as diabetes, severe allergic reactions, seizures, adrenal insufficiency, and asthma. Any other health conditions or needs should also be listed. The nurse then determines next steps, which may include parent contact and staff training. If all responses on a form are no and no health concerns are identified, the form does not need to be uploaded to Google for nurse review. However, you must still email the nurse to confirm that there are no health concerns at your site. This email serves as documentation for our records. The form should be kept on site and made available upon request. If any questions are marked yes, or if information is written in the section below the dotted line, the form must be uploaded. This is considered a positive questionnaire. Attach a scanned PDF of the health questionnaire using the Add File button. Make sure you only submit one form at a time. Submit the health questionnaire only if health concerns are indicated. This should be done within 5 days of the completion date of the PFA site enrollment forms. Scan and save the completed questionnaire as a PDF. Then complete the Preschool for All health questionnaire uploads Google form and attach the PDF. Remember, only one student's questionnaire per Google form. If you have problems with completing any of these steps, contact your inclusion coordinator or PFA nurse. Use this Google form to upload the health questionnaire. Submit only one positive health questionnaire per student, as each form is sent directly to the nursing team. Be sure to include your name and contact number so you can be reached if any questions arise. The Google form will ask for the name of the school site, the name of the nurse assigned to your site, and the student's last and first name as it appears on the enrollment forms. You will also need to include the student's date of birth and ID number if one has been assigned. Finally, attach the health questionnaire PDF document before submitting the Google form. Be sure the file appears in the Add File section prior to clicking on the Submit button. Staff are required to receive training whenever a PFA nurse identifies a PFA student with a health condition. If a PFA student needs medication during school hours, staff must complete medication administration training. The nurse will work directly with site staff to schedule training dates. Some students with more complex health needs may require the nurse to visit multiple times to provide support and training. Each preschool site should have at least 2 staff members trained in key health and safety areas. These include medication administration, severe allergic reactions, and bloodborne pathogens. It's important to note that, due to state requirements, these trainings cannot be provided by a parent or an outside healthcare professional. Examples of students who may require this level of support include those with diabetes who need daily insulin injections, or students who require daily G-tube feedings. PFA nurses will identify what training may be needed at your site. We offer bloodborne pathogens, medication administration, severe allergic reaction, and glucagon administration. This chart outlines the different training requirements for unregulated assistive persons, or UAPs. This chart is available for review on the PFA website. Classes are typically 90 minutes, and a certificate of completion will be provided for your ORO training. Staff are responsible for tracking expiration dates, as reminders may not be sent. Bloodborne pathogens and medication administration certificates are good for 1 year, and then will need to be renewed before they expire. Severe allergic reaction, glucagon, and adrenal insufficiency certificates are good for 3 years. Instructions on how to renew your certificates will be given to you at the time of training. Let's walk through a few scenarios and how to respond. Health Scenario 1. A family informs you that their child was diagnosed with type 1 diabetes over winter break. What steps should you take, and who should you contact? First, let the family know that the PFA nurse will be contacted. The nurse will then reach out directly to the family to gather detailed information about the student's health history and current needs. Next, the nurse will begin coordinating with school staff. This includes arranging training and delegation for diabetes management, as well as scheduling times for required staff training. It's also important to review the student's health questionnaire. Consider, was a form originally completed indicating no health concerns? Was a form completed with medical information but not uploaded? Did the student's health status change during the school year without an updated form being submitted? Ensuring that all health documentation is accurate and up to date is a critical step in supporting the student safely. Health Scenario 2. A parent tells you that their child went to the emergency department over the weekend after eating strawberries. The child has now been diagnosed with a severe allergy and has been prescribed an EpiPen. You have previously taken a CPR and first aid class that included EpiPen use. What are your next steps, and who should you contact? First, contact the PFA nurse and inform your supervisor. The nurse will schedule a visit to your site to provide training on severe allergic reactions and proper EpiPen administration. It's important to understand that when a Preschool for All student has an EpiPen, staff are required to receive training directly from the PFA nurse. This training will also include how to manage allergies within the school setting. Please note, training provided by a parent or an outside healthcare professional does not meet state requirements. Additionally, prior CPR or first aid training alone is not sufficient. Following these steps ensures that staff are properly trained and the student is safely supported. Additional health supports. PFA nursing services can also support your site when a PFA child has health needs such as seizures, G-tube feedings, urinary catheterization, or feeding concerns. We also have a dedicated feeding team to assist children with feeding-related needs. If you have any questions or concerns, please contact your PFA nurse or fill out the feeding team referral form. Examples of feeding concerns include a parent providing pureed food, a child coughing while eating, a choking incident, taking longer than expected to finish meals, needing food cut into smaller pieces than is typical for their age. If a Preschool for All student has any of these conditions or any other health concern, it is important to notify the PFA nurse as soon as possible. The family will also need to complete an updated health questionnaire to ensure all medical information is current and accurate. Early communication and collaboration help ensure every student receives safe and appropriate care. Thank you for your time. We look forward in supporting your school. For questions or concerns, please contact your team. If your nurse cannot be reached and you need immediate support, please call School Health Services at 5032-571-732 and ask for a nurse supervisor.